Have you ever been walking down the street and have somebody ask you, do you have any money? Can I have some change? Do you have any change? What if that person was actually a child? This is going to be an oral report. It's going to be a discussion about the relationship between child care, poverty, and health. My conclusion is going to be that child care should be free or affordable. The idea of poverty, we have to first of all define what it is. Poverty is determined by the number of people that live in a person's home and the size of the city in which that person lives. Now, we live in Saskatoon. Its population is between 100,000 and 500,000. So the low income cutoff rate is $27,000. Now, I'm going to discuss all of the levels of government. First, we have the national, provincial, and municipal. On a national level, Canada has a similar spot amongst the range of 26 industrial countries. Canada places 19th as far as child poverty is concerned. Other countries on the bottom are United States, United Kingdom, Australia, New Zealand, and Mexico at the very bottom. Now, in the middle are countries, they're called conservative democracies, and those would be the European democracies who believe in social support networks, and there should be some social intervention in child care. And finally, you have the Scandinavian countries who are at the very top with the child poverty rates of 3 or 5%. Okay, that's on the national level. Now, on the provincial level, Saskatchewan ranks 9 out of 11 provinces. In terms of child poverty, Saskatoon has a child poverty rate of 25%. That's 1 in 4 children live in poverty. Now, I'm going to demonstrate the disparity between the low-income neighborhoods and the high-income neighborhoods, or the affluent neighborhoods. And really, you're going to see the low-income neighborhoods are on the west side of the city, and the high affluent neighborhoods are on the extreme east side of the city. The low-income neighborhoods have an average income of $30,000. The number of people in that area is 18,000. The percentage of children in poverty is 44%. We'll look at the affluent neighborhoods. Now we have an average income of 99,000. The number of people would be 16,000, and a poverty rate of 3.7%. That's quite a disparity between one area of the city and the other area of the city. In 1974, there was a Minister of Health and Welfare by the name of Marc Lalonde. He wrote a paper discussing and analyzing the perspective, health in Canada. The discovery he made, the conclusion, was that health was determined not within the healthcare system itself. It was actually determined by factors outside of the healthcare system. It stands to reason today, but this was a new idea at the time, and ever since Canada has produced papers and papers and papers which analyze and observe and try to understand